10 years before nutrition was a part of what we do, it was all about skincare. And these supplements help your skin tremendously. One thing that I notice is my nails are hard as rocks. It's amazing. And there's another supplement called HNS, Hair, Nails, and Skin, that Nu Skin created umpteen years ago at the beginning stages. Excellent use of hair, nails, and skin nutrition. But LifePak Nano gives you everything. It gives you the HNS as well as all the other organs. This photoprotection, there are studies out there that tell you that the higher your carotenoids levels, the lower your risk is for skin cancer. Why is that? Well, if your skin has carotenoids in it, and the ultraviolet light and the free radicals are trying to attack you, you've got protection. The omega-3 fatty acids, we know that omega-3, omega-6, our diet is very, very large in omega-6, very low in omega-3, and that's why the use of supplementation is necessary. This helps you provide that, and the ratio of EPA and DHA is appropriate. It's appropriate because if it's not going to work as well. So totally you have 4 grams of fish oil and the krill. The krill oil, I've got to tell you a little bit about the entire process of the omega-3 fatty acids. If you think, where do they come from? Fish oil comes from fish. And if you take fish and you extract fish oil through the process, if you get large fish, you're going to get a higher concentration of heavy metals. Because with the toxicity that goes on with the fish population, the tiny fish get eaten by the little fish, who get eaten by the medium-sized fish, who get eaten by the big fish. And as you go along that process, the concentration of heavy metals increases as you go up in the size of the fish population. So where do we get our fish oil from? We get it from anchovies, sardines, and krill, the little tiny microscopic fish that whales eat. So we're looking at the food chain, at the part in the food chain that gives us the least amount of toxins possible. That takes a lot of effort. Well, how do you know how this is processed? Well, what Nu Skin Pharmanex does is they're in charge of who processes and who harvests the products. So we know where it gets harvested from. We know where it gets processed. I don't know if the other companies care. There's also another very interesting fact. Out of all the products, out of all the raw materials that come in, 80% of it gets rejected because they don't meet our 6S process. So what happens to the other 80%? Do you think they get disintegrated? They go into a receptacle and they get destroyed? No, they go to people who will buy it. And they go into products that are not Pharmanex. And I don't trust where they come from. I trust where these things come from. And with me, it's all about safety. Benefits of the omega-3 fatty acids. This inflammatory response. You speak to a rheumatologist about your osteoarthritis or any other type of arthritis problem, and the great majority of them will put you on fish oils. You speak to an eye doctor and you have dry eye, you're going to walk out of there with fish oils, a sample. And, but you're just going to get a sample. Imagine getting a complete, comprehensive nutritional package. Supports weight loss. There's many aspects to burning calories that requires all of these nutrients to work right. I hear from a lot of my patients that when they take the LifePak Nano, it's easier for them to lose weight. Why? I don't know if it's a placebo effect. I really don't care, because all I care is the end result. And there's an interesting phenomenon that occurs. My LifePak is gone from this morning, but I have mine for dinner here. And when you take that package, the process of taking that supplement does something to people's brain, because it's really hard to open up that package, take it with food, and and then eat something bad. It just goes against you. And call it a placebo effect, I don't care what it is, but it changes behavior. Another side that I'll take, how do you get people to comply with this stuff? Because there's 5 capsules on one part of the sachet and 2 capsules on the other, and you take it twice a day. I've been taking it for 6 years. I probably average 11, 12 times a week, and I just got into a habit because I value it. There's many different ways to do it, but I actually teach my patients how to swallow pills, so I'll give you a little pearl. For people who can't swallow pills, I start with one pill. And I take something small, so they don't get fear brought up. I have them take a pill, have them put it in their mouth, and take some warm water, swish it in their mouth, tuck their chin, and swallow. If you tuck your chin, it's an easier pathway into your esophagus and into your stomach. If you extend your neck and try to throw the pill back, you will open up your airway and choke. For those of you who are physicians or nurses who are ever in the process of intubating a patient, putting them on a ventilator, what we do, and I was an ER doc, is we would extend your neck and it would open up your airway and we can get straight down into your lungs. I don't want my pills getting straight down into my lungs, so why would I want to extend my neck and throw the pills back? It makes no sense, but it's people's habits. And I've taken people that have had lifelong problems of swallowing pills tell me, no one ever told me that. So I made a little video, one of my few videos, but I made like a 90-second video on how to swallow pills. So it's on YouTube. So you can use that. It's kind of cool. I might actually get a few hits. As an aside, not as much as my friend. He did a video, he had 12 million hits. But I'll tell you that story afterwards.